Hello and welcome to a very special discussion, and it's on tuberculosis. And of course, joining us today, right here at Oman Daily Observer, is Dr. Mohammed Redha. He's the head of National TB and AIDS Control Program from Ministry of Health. Welcome to the program.
Thank you.
The world is celebrating Tuberculosis Day. Oman is going to be doing it in Soor. Can you tell us?
Yes, tomorrow morning we will be starting our function in Soor, and which will be followed by a workshop, scientific workshop, in which participants will come from all over Oman, and also we are getting 3 special guest speakers from Saudi Arabia on this occasion.
What is the message that is being conveyed and the theme of this year?
The theme for this year is that every patient counts. That means we should find the TB patient, treat and cure him, because it is a curable disease.
Now, usually the trend has been that even if it's a private sector hospital who diagnoses the case, they immediately contact the Ministry of Health.
Well, that's right, yeah. But last year we have now introduced a strategy called public-private mix in TB, where we are training the private doctors in the private health institutions, in the hospital, and also in workplace, to how to diagnose TB and how to treat. And inshallah, this process will strengthen the National TB Control Program.
What is our statistics when it comes to TB cases?
TB, alhamdulillah, in Oman is very well under control. The National TB Control Program is one of the strongest. We started in 1981. And since then, our statistics show that the incidence rate has come down from 21 per 100,000 to 3.5 per 100,000, which is one of the lowest in the world.
Okay. Now, because you head both programs for tuberculosis and AIDS, it is a combination that can actually affect anyone with HIV would easily fall into the problem of TB, isn't it?
That's right, yeah, because patients with HIV have reduced immunity, and then so they get TB very easily. And the combination of TB and HIV is called lethal combination. But alhamdulillah, again, we have very strong national AIDS control program, and because of that, our numbers are very few. Like every year we get 5 to 10 cases of combination TB and HIV.
What is TB?
Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis, and when it is transmitted through the droplet, so that if somebody has TB and if he coughs, he can transmit it to the people around him.
Now, what should the public know about, and when to know that this is a dangerous symptom that we're seeing?
Well, the most tuberculosis is of 3 types: pulmonary TB, which affects the lungs, and extrapulmonary TB, which affects any organ outside the lung, and latent TB. And the most dangerous is pulmonary TB because it affects the lungs, and every time the patient coughs, he can transmit the disease. And in extrapulmonary, it can affect the lymph glands, the bone, the spine, the intestines. And this extrapulmonary is not transmissible, but the diagnosis will need a biopsy. So the patient will develop symptoms related to that organ which is affected, and the biopsy will show the disease. Latent TB is when the bacteria is inside the body, but it is dormant, sleeping, and the patient and the harbor or the carrier does not feel anything. This is called latent TB. It is diagnosed with either a blood test or a skin test. And about 1/3 of the world population, about 2 billion people, are estimated to have latent TB. And in most of the cases, it is considered that this is the reactivation of the latent TB, which occurs in old age or when the body defenses, immune mechanism goes down, that develops the active tuberculosis.
Now, the bacteria is there anywhere in the world, isn't it?
It is, yeah, it is all over the world. We are one of the low endemic countries. In high endemic countries, like Africa or the Indian subcontinent, the incidence rate is more than 200 per 100,000. And but because of the efforts of the WHO and International Union Against TB and lung diseases, it is the first time in the history of TB itself that the incidence rate all over the world has started dropping. The death rate, the mortality is dropping, and which is really very encouraging. And the world community first time feels that we can actually get on top of this historical deadly disease.
Yeah, we've always heard about it in history,
right.
yes.
That's right, yeah. So that is really very good news.
What can a common man do?
Well, number one is to protect his live a healthy lifestyle. You know, live in the room should be ventilated. And if anybody has symptoms like cough and sputum, fever, night sweats, weight loss, he should consult the doctor as soon as possible, so that if he has TB, a diagnosis can be made.
If it's a regular pattern
Yes.
of this fever and the weight loss.
Yeah, it starts slowly and then continues for over a week. So anybody, if they have cough or fever for 2 weeks, they should definitely go to that.
Okay, with that note and great advice from Dr. Mohammed Redha Alawati, thank you for joining us, sir.
Thank you for inviting me.
A pleasure for you to join us here on Oman Daily Observer, a special discussion, and with that we wrap it up today. I'm Lakshmi Kaufanath, and Dr. Mohammed Redha Alawati is the head of National TB and AIDS Control Programs, Ministry of Health.